Hey there, and welcome to my channel. My name is Dr. Jessica, and I'm a naturopathic doctor and acupuncturist as well as a health coach. And I work with clients who are chronically stressed, feeling overwhelmed, maybe anxiety, difficulty sleeping, fatigue, all the things that kind of come along with being stressed and maybe burned out. So one of the things that I often recommend in dealing with stress, especially chronic stress, is meditation or mindfulness. And this also helps not only with the stress, but also sometimes the anxiety that can come along with it. So there was a recent study published in JAMA, their psychiatry journal, that asked the question, is mindfulness-based stress reduction techniques as effective or not inferior to escitalopram, which is also known as Lexapro, which is a very common anti-anxiety medication, or it is also an SSRI. Now, I have seen clinically that doing meditation or mindfulness-based stress reduction, which is often mindfulness or different types of meditation, can be very helpful and very effective in dealing with anxiety. But up until now, there have not been a lot of studies that compare how well those techniques do against an actual medication or an SSRI. So that is exactly what happened in this article. But this article asked the question, how effective are these mindfulness-based stress reduction techniques in comparison to escitalopram, to be specific, which is also known as Lexapro. So it is a very common SSRI, or selective serotonin reuptake inhibitor, that also works very well for anxiety in some people. So this is probably one of the first studies I've seen that actually is comparing these two different types of treatment and asking the question, how well does meditation or mindfulness stack up against a medication? So let's take a deeper look into the study and let's see what the results were. So again, this article was published in JAMA, their psychiatry journal. And the interesting thing about it is that it is actually a randomized clinical trial. Now, you may be asking, well, how can you randomize meditation versus getting a pill? And it wasn't that the participants didn't know, it was the people who were judging, or the raters as they call them, the people who were judging the scores of people's anxiety. They were blinded as to, so meaning that they did not know which group the participant was in. So that's where the randomized part comes from. But let's dive in a little bit into the details here. So in total, of the participants that finished the study, there were 208 total. They varied in age from 18 to 75. They had a wide variety of ethnicities, as well as a good breakdown of male versus female as well. And there were two groups, a group that got a 10 to 20 milligram of escitalopram, or a 8-week training in mindfulness-based stress reduction. Now, it's important to note that this was not just a kind of willy-nilly go do meditation on your own. So it was an 8-week course in which participants have a weekly course, as well as 2.5 hours of instruction during that week, as well as 45 minutes of practice where they're actually working on the technique. So techniques in this sort of called MBSR, so mindfulness-based stress reduction, include things like breathing exercises or awareness of the breath, body awareness, so doing some sort of body scan, and mindful movement, which often looks like yoga. This type of technique was actually created back in 1979 by Dr. John Cabot, and it's probably the most researched version of mindfulness or meditation that we know of. So I think that's why they went with this version. But knowing that it kind of looks like practicing for meditation and practicing things like yoga and practicing awareness on the body, basically what we are doing in meditation or doing with yoga. One more thing we need to know is, how did they measure someone's anxiety levels? Well, they gave them a questionnaire. They answer questions as given by what we call the raters. And the method that they use is called the Clinical Global Impression of Severity score or scale. And this is where the rater is asking them questions, and based on their answers, they are giving them a score of 1 to, I believe it's a 7-point scale, based on how severe the symptoms are. So they did this evaluation before starting the study, I believe, again, at the midpoint, and then at the 8-week. And then they also had a follow-up at 12 weeks as well as 24 weeks to check how well the participants were doing. So basically the key points or the results of the study was that mindfulness-based stress reduction was non-inferior, meaning it didn't give worse outcomes than the escitalopram for the treatment of anxiety in this study group. So what they are kind of concluding here is that mindfulness-based stress reduction is a well-tolerated treatment option that has a comparable effectiveness to first-line medication such as escitalopram for treatment of anxiety. Now, this may sound like, well, yeah, duh, we kind of already know that. But the important thing here is that we finally have some sort of randomized controlled trial that actually says, yes, mindfulness-based or meditation is good for anxiety and sometimes works just as well as a medication or an SSRI. So I think that this is kind of really important for people to know. I think that the more evidence we have in using these types of techniques and the more that we can share it and the more people are aware of it, the more that maybe they're willing to try these sorts of treatments and try these sorts of techniques. So I thought this study was really awesome because it's literally the things that I teach inside of my course, The Better Health Blueprint. We talk a lot about mindfulness. We talk about finding a method that works for you. I don't just tell you to go meditate. We talk about different types of meditation and how to actually do them. I also have guided meditations inside of the course. And I also talk about yoga as well as how to actually do yoga and how to do these breathing exercises to bring more awareness to your body. So if you have questions about that or would like to learn more about working with me inside of that program, you can click the link below and we can figure out if it would be a good fit for you. So again, if you have any questions, be sure to leave them in the comments below. Be sure to give this video a thumbs up. It helps other people find the channel. It's not just for vanity, but be sure to subscribe and hit the notification bell so that you can know when I post a new video next week. And I will see you in the next video.